The BC Cancer Agency has a provincial mandate to improve cancer control and the quality of life of people living with cancer. We have 6 cancer centres and 33 community oncology network clinics throughout the province, and we work to ensure a high quality and consistent patient experience wherever patients are treated. Patients with cancer and their families experience a variety of difficult emotions throughout the cancer journey. Providing emotional and psychosocial support is as critical to a patient's well-being as the surgical, radiation, and drug treatments they also receive. I am very proud of our team who have done this important work to enhance emotional support for our patients.
So in 2013, we conducted a provincial outpatient cancer care survey, and in that over 13,000 patients responded. And what they told us was that despite the care being very good, excellent, and good at 97.5% of the time, there was more work that could be done around emotional support. Those scores were lower than the Canadian average. And so this project really took that patient experience information and data and brought it to life through focus groups, interactions with professionals, and has really changed the whole culture of the organization.
We gathered 56 leaders from across BC, including the BC Cancer Agency, as well as the other BC health authorities to work on this transformation. 3,000 patient comments were trended and shared with patients and families in focus groups that were held throughout BC over a 4-month period. The King's Fund co-creation model was used to identify and validate concerns and co-create solutions for improvement.
I was asked to participate in the patient staff focus group to bring forth concerns I had with emotional support and suggestions to make things better. Overall, staff provided excellent care. We focused on 2 questions. The first question was, if you had any worries or concerns during your treatment or visit, did your care provider discuss them with you? The second question we discussed was, did you know who to go to with questions?
My sister and I live on Vancouver Island, and our sister Wendy received cancer treatment through a community clinic. We participated in the focus groups because she asked us to use her story to help others. Giving back to other patients, families, and providers is also very important to us. Wendy would be happy to know that we are sharing our stories for learning and improvement.
My sister received excellent cancer treatment from healthcare providers who really cared about her. There were also times when care needs could have been coordinated better. For example, more information, better communication, and increased availability of counseling support throughout all phases of her journey could have reduced stress for all of us during what was already a very stressful experience.
During my treatment, I really wish I had the opportunity to speak to other people that were going through the same type of cancer as myself. I'm very proud to have participated in this initiative as a former cancer patient and seeing that my ideas have been heard and acted upon, thus initiating change.
We implemented the top solutions that patients and families recommended. We already had the services, but realized that we did not market or promote them as well as we needed to. And we also needed to transform the culture to where all staff were aware of the emotional support resources and where to find them.
Having the emotional support campaign has really improved our staff and patient awareness of the resources that are available. For example, Cancer Chat Canada and Cancer Connections. The educational sessions were helpful for reminding staff of the resources available. They also gave teams a chance to talk about how best to approach the topic of emotional support with patients and families.
One of the great things about this campaign is that it encourages conversations amongst staff, patients and families, and really reminds us that our emotional well-being is as important as our physical treatment.
We've partnered with the Emily Carr University of Art and Design to develop 5 slogans and the look and feel of the promotion. Our patients and families and staff were invited to vote on the design that meant the most to them. 156 patients and families and 205 staff voted for Every Experience is Unique, cancer support for however you're feeling. The advertising campaign included elevator wraps, posters, business cards, and pamphlets given to all new patients.
Our team was able to choose many faces showing different emotions to depict the range of what cancer patients experience every day. Patients have told us that they're sometimes tired, sad, sleepy, as well as relieved or happy when they've received news that they've successfully beaten their cancer.
This has been great for all our staff and physicians, as we are all more aware of the resources that we can offer our patients and families when we see them in our clinics. The education for staff and promotional materials has been implemented in all health authorities, and every GP office has been sent information about the BC Cancer Agency emotional support resources with a poster for promotion in each GP office.
Our evaluation results show that our Cancer Chat numbers are up and that our staff were more aware of Cancer Chat, Cancer Connections, counseling, and support groups. Now, 50% have shared, 52% feel equipped to share, and many more staff are aware of where to find the information. But what matters most is that our patients and families have now scored emotional support in British Columbia over 90%, compared to a Canadian average of 47% prior.
This leadership from the BC Cancer Agency, in partnership with the other health authorities, is an important model for PHSA. This transformation truly illustrates patient-centered care when healthcare leaders listen to our patients, their families, and staff, and are able to implement solutions they recommend. Often these solutions are so much simpler and wiser than ones we create for them. Congratulations on this achievement. This is truly great for the patients and families we share.